A primary care sports medicine physician is a physician who initially trained in primary care, so family practice, internal medicine, emergency medicine, pediatrics. And then they go on to complete a fellowship in the sports medicine field, which is usually 1 to 2 years. And at that point, they get trained in how to treat musculoskeletal injuries and non-operatively. So we don't do any type of surgeries. It's all non-operative, which a majority of orthopedic injuries are. So we can handle those, such as sprains, fractures, any type of injury really. So you should see a sports medicine physician if you have any type of injury to any type of muscle or joint. So your shoulder, elbow, knee, hip, any of those, especially if they've been persistent and it's something that hasn't resolved on its own. And maybe you've tried those different types of treatments such as anti-inflammatories, stretches on your own, and it hasn't gotten better. That would be a great time for you to seek further treatment by a sports medicine specialist. The non-operative treatments that a sports medicine physician would do would be prescribing an anti-inflammatory or physical therapy, and probably physical therapy is one of the most used modalities that we use in primary care. And other than that, just trying to ice and things like that. We do regular injections such as corticosteroids, but we also do more advanced injections that are hyaluronic acid like Synvisc, Orthovisc, and things of that nature for arthritis or meniscal injuries. And then some sports medicine physicians do use ultrasound in those injections or for other treatment and diagnosis utilities. So if we have patients as primary care sports medicine physicians that ultimately need surgery, we usually already have those relationships formed with orthopedic surgeons. And for example, in our office, we have many orthopedic surgeons within the office itself. So once you have an injury that we determine needs surgery, we can usually expedite the process to get you in to see the surgeon for a surgical evaluation. Sure, and I've always been a runner for my entire life, and so that played a big role as to why I went into sports medicine, because I'd like to help the active population. The active population really does seem to want to get better, and they usually do those rehab exercises and will do the modalities that you suggest. And then I also am very passionate about women's health and specifically women's sports medicine and helping the active patient from the young age, as in teenagers, all the way up to the elderly population. So I think it's really important that we help them build their bones and keep them safe from the younger age to the elderly.